You have learned from the previous sections how to best communicate your pain experience. You now know how important it is for you to partner with your provider in the efforts to manage your pain. Your ability to describe what you are or have been feeling related to your pain experience provides you with the power to positively impact the decisions made by your provider for your best care. Your powers do not stop there. In this next section, we look at other options that you have regarding the management of your pain experience, and we will review some pain management pearls to further your understanding and to further your ability to positively impact the best management of your pain. Let's first discuss some possible roadblocks that can interfere with achieving the best pain management. Know that you are your best advocate when it comes to the management of your pain experience. Tell your provider about your pain. Your understanding of the pain assessment and the tools and details used for obtaining a complete pain assessment will empower you to confidently speak up for yourself. Your ability to use effective and detailed language to report your pain experience is most important, as unrelieved pain can have very negative effects. We know that unrelieved pain is known to decrease healing time. It has a negative impact on sleep, on relationships, and mood. It decreases overall quality of life. Some individuals mistakenly do not report their pain because they do not want to be considered a bad patient. They mistakenly think that if they talk about pain to their physician, it will interfere with the physician's focus on their disease. Another barrier is the fear of bad side effects or even addiction. These fears can interfere with getting treatments or medications that can actually be very helpful. Report your fears and concerns to the provider so that you can have a discussion to clarify any concerns or misconceptions. Your understanding of effective pain management can be overcome by your becoming more aware. Continue to ask questions and learn how you can make each day the best that it can be. It all starts with you. You may be happy to know that you also have the power to impact on your pain experience by learning about treatment options other than medication. These treatments can be added to or with your current medication treatment plan. If in doubt about adding any of these other treatment options, talk to your provider. For example, the safe placement of hot or cold packs to areas of localized pain can often provide added relief. Some individuals have found that massage is beneficial. Other things like learning to exercise properly, to meditate, to do deep breathing or yoga breathing exercises are helpful and can reduce the anxiety related to pain. Watching a funny movie or working on a hobby like knitting, crocheting, painting, or woodworking can be excellent distractions from pain. Some people find relief with prayer and with interacting with their spiritual leader or organization. It's important to know that proper use of assistive devices such as a cane or walker can also help you maintain your independence and keep you engaged in your life. Medication safety and management are very important. It is important for you to have an understanding of the medications that have been prescribed for you. You can speak with your provider or your pharmacist to ensure that you understand what you are taking, what it is expected to do for you, and how it is scheduled to be taken. This is especially important with your pain medications. Every time you come to Carmanis, you will be asked for a current list of your medications. When patients are on many medications, it is difficult to remember them all. You can keep your medication log from your patient portfolio and keep a list of your current medications, or use any type of list that you find easy to keep with you at all times. There are many little blue, yellow, or white pills. You need to know the name of your medication. You need to know the dosage, how it is scheduled, and you need to share this list with all of your medical providers. Some medications are long-acting, meaning that they are special time-released preparations taken on a set schedule to allow a steady state of that medication in your system to provide continuous relief. Other medications are short-acting and are scheduled on an as-needed basis. These are taken when you start to have pain or are doing something that you know will cause you to feel pain. You should know the exact time that each medication should be taken. Also, some medications are started at lower doses at first and then slowly increased or titrated to reach their full benefit. The long-acting and titrated medications cannot be stopped abruptly. To do so could cause you to experience bad side effects. Always check with your physician before discontinuing or stopping a medication to avoid any bad side effects. Side effects could be nausea, vomiting, sweating, chills, or even seizures. So take all of your medications only as prescribed. Be informed about the medications that you are taking. Ask specific questions about the medications that you have been prescribed. Do not increase or decrease your medication without first checking with your physician to avoid overdosing or any bad reactions. For your safety, it is best to have all of your prescriptions filled at the same pharmacy. That same pharmacy will then have a record of all of the medications prescribed by all of your physicians, and the pharmacist there will be able to identify any incompatibility issues or problems with mixing or combining the medications. Only one physician should prescribe any narcotic or opioid medication. This will serve to protect you by ensuring that these strong medications are prescribed and monitored properly. Do not share your medications with others or take medications that belong to someone else. To do so can be very dangerous, as different medications work differently for different people. Also, be mindful of the responsibilities you have associated with your narcotic or opioid medications. Keep all of your medications in a safe and private place. When possible, lock away these medications to prevent them from getting into the hands of children or others that might want to steal them. While these medications can be very beneficial, when they get into the wrong hands, they can also be very dangerous. It is important for you to understand the potential side effects of your medication. Unpleasant side effects can make patients fearful about taking medication that can actually help to manage their pain. Ask your physician what to expect from any new medication. When first starting, some medications can cause sleepiness, itching, or nausea. But these side effects can usually be managed by starting the medication at a lower dose and then slowly increasing the dose. This allows the body to adjust to the medication, and these side effects typically go away. If the symptoms persist, your physician will make the appropriate changes or adjustments. Some patients confuse side effects with being allergic to the medication. This is not necessarily true. Be sure to make your physician aware of any side effects that you may experience. Your physician will tell you if you are having an allergic reaction or if you are experiencing a side effect of the medication. Constipation is a common reason given for stopping opioid medication. While constipation does not go away while taking opioids, it is not a good reason to not take these pain medications, as this known side effect can usually be managed with an appropriate bowel regimen of stool softeners and laxatives. When starting an opioid pain medication, a bowel regimen should be started at the same time. Keep your physician informed of any continuing bowel problems. To clarify some misconceptions related to medications and to reduce some of the fears associated with taking opioid or narcotic medication, we need to define some terms to help provide you with a better understanding. After a medication has been taken for a long period of time, the patient may start to notice a change or decrease in their pain relief. When this happens, your physician will determine if the medication requires a dose increase. This does not mean that you have become addicted to the medication. Over time, the medication has become less effective as the body has adjusted to it. The physician may also decide to change to another medication or determine if there has been a change in your condition requiring a change in your treatment plan. Dependence is a common occurrence associated with long-term use of opioids and some other medications. It can actually occur as soon as just weeks after starting these medications. This occurrence is also the result of the body becoming adjusted to or dependent on the medication. This is why these medications cannot be stopped abruptly. Suddenly stopping these medications can result in very unpleasant symptoms known as withdrawal symptoms. These symptoms include chills, nausea, vomiting, and diarrhea. They are very unpleasant and can also produce unhealthy results. This is why you do not stop taking any medication without first speaking to your physician. Again, experiencing this does not necessarily mean that you are addicted to the medication. Addiction is a disease. It is a behavior whereby an individual uses opioid medications or other substances for purposes other than for what it was intended. The individual uses more of the medication than prescribed and uses it in spite of knowing the harm that may come to them by this usage. The medication is taken by these individuals for use other than pain relief. They take it to get high, to experience euphoria, or sedation. These individuals may also take illegal street drugs. They may sell their prescription medication on the street for profit or trade it for illegal drugs. The addicted person will also experience withdrawal symptoms like chills and nausea, vomiting, and diarrhea if this medication or their illegal substance is suddenly stopped. Addiction needs to be treated by a specialist in addiction. If you have questions or fears about addiction, discuss them with your provider. People suffering from addiction can have their pain managed with special precautions. The takeaway points in this last section include: once fears and misconceptions about pain medications and treatments are openly discussed, it often results in breaking down any barriers to receiving effective pain management. This concludes the Language of Pain 3-part series. Your attention is appreciated, and we hope that you found this presentation beneficial. You may repeat all or any part of this at any time during your stay. Feel free to ask for a consultation with the pain management coordinator if you have any questions about your pain management that cannot be answered by your nurse or doctor.